This video is going to go through ACL rehab after surgery in and around the week 3 to 6 mark. So it's important to keep working on knee flexion at this stage. Using a towel for some overpressure can be useful. We don't want to be putting patients into severe pain or pushing the knee past a range it's not going to like. So working on lumbo-pelvic strengthening is a good option at this point. So we've got our normal standard double leg bridges. And once some strength and confidence is built up, we can move on to some single leg bridges. Not worrying too much about comparing limb to limb at this stage. It's still early days. Just doing the exercise alone will be enough. So building up confidence and proprioception is another exercise we can work on. So that's single leg balance. Move it into progressions such as eyes closed. Then once we get comfortable with eyes closed, we can move on to some dynamic balance with a cushion. Just be wary at this stage. We want to have some support close by because it's the first time the patient is going to be working on dynamic balance or an unstable surface. So we want them to have the confidence that if they feel like they're going to fall or be unstable, that they've got something to hold on to. So working on some functional rehab, just simple step overs, not too high over a barrier, just getting that patient to effectively lead with that operated limb over the barriers. Just looking for a good symmetrical motion and the ability to put full weight through that limb. Then some lateral step overs. We can look down as we first start doing the exercise, as the patient gets a bit more confident, more familiar with the exercise, working on proprioception a bit more, looking ahead and not looking down. So the body should automatically know where the foot's going to go in between the barriers. Then some weight-bearing quadricep strength in the form of step-ups. Patient may be quite slow in the first few days doing this exercise, but as the confidence and the weeks go on, the speed might increase a little bit. This can be progressed to a step up with march, so leading with the operated side, just going to increase the strength, balance, stability on the operated side. And this is a good way of testing, is that patient ready to move on to the next stage? Do they feel confident with the limb? Are they still limping? And just basically, do they have the strength and stability on that side? So we still want to carry over some of the exercises from previous weeks, such as partial squats, not going too deep at this stage. Additionally, for cardiovascular exercise, as flexion increases, we can progress to some static bike. So we can start off with something very easy, just a few minutes to start with, and build it up as time goes on. Criteria for progression, we still want to make sure that the patient has a nice straight knee when they're walking. Ideally, towards the end of week 6, we don't want to see the patient limping around. We want to have a nice symmetrical gait, and we're going to try and get as close flexion as possible, within 10 to 20 degrees of the non-operated side, and ideally no real post-exercise effusion. So when the patient does their exercises, ideally we don't want the knee blowing up because that suggests that everything's just a bit too much at the moment.